NHS Hambleton, Richmondshire and Whitby CCG buys healthcare services for a predominantly rural area with an ever-increasing and ageing population, many of whom live with multiple long-term conditions. Some of the community health services we buy could be improved. Some are outdated, access to services is imbalanced across the area, and they are not all sustainable on our budget. We want all our population to get the care they need when they need it. Meet Sarah. She's 76 and suffers from heart failure, rheumatoid arthritis, and has recently been diagnosed with cancer. Sarah was coping pretty well until her husband sadly passed away earlier this year. He was her main carer. Although she loves her village community, she's feeling more lonely and rather anxious. Decreasing mobility in Sarah's legs has caused her to fall. She's taken to her nearest A&E and transferred to a busy hospital ward where she stays for a number of days to recover. Although she receives excellent care, she misses the views out of her living room window and being able to make a cup of tea. Sarah wants to go home. The consultants tell her she doesn't really need to be in the hospital, but she can't go home as she doesn't have the right facilities to support the rest of her recovery. When Sarah is eventually discharged, a lack of coordination between her health and care providers means she is left confused. She sees lots of different healthcare professionals, and each time she has to explain her conditions and the medication she takes. She finds this exhausting and is left feeling very frustrated. But what if Sarah's health and care services were more joined up? What if she could leave hospital earlier to recover nearer her own home, where her friends from the village could visit? Let's look at our new proposed model of care and how this could improve Sarah's health and well-being. Meet Dr. Ellis, Sarah's GP. He is given overall responsibility for ensuring her care is coordinated. Dr. Ellis meets with Sarah, her district nurse and other health and care professionals. Sarah explains that she wants to manage her conditions at home, or as close to home as possible, instead of going into hospital, and that if she has another fall, she wants to leave hospital earlier to recover nearer home. Together they share information about Sarah's needs and design her new care plan. Dr. Ellis now visits Sarah at home regularly to support her in managing her own care. He has also introduced her to the local volunteer group, and now a volunteer called Patricia comes to visit her at home. This helps Sarah to feel less isolated and gives her the confidence to look after herself. On the occasions when she is very breathless because of her heart failure, Dr. Ellis arranges for Sarah to use a step-up bed, which gives her the extra short-term care she needs. As a result, Sarah is spending much less time in A&E. Even if Sarah is admitted to hospital, she is discharged to a step-down bed following treatment, which helps to support and prepare her for her return home without having to undergo reassessment of her needs. So now, Sarah doesn't usually have to be admitted to hospital when she is feeling unwell. She can be cared for closer to home by an integrated team of professionals who understand her needs. Sarah feels happier and is managing her conditions well under her new model of care, which makes more efficient use of local resources. This approach is better for Sarah, better for her health and social care providers, and better for the local community. Let's recap on what transformed Sarah's care. Put simply, local leaders in the NHS, social services and the voluntary sector created a shared vision of what a good, integrated care team looked like, centred around the needs of people like Sarah. They improved information sharing and communications and pooled resources across health and social care to build a successful, integrated care team that supports people in their community. To find out more about our new model of care, please visit www.hambleton, Richmondshire and Whitby CCG.nhs.uk.